Please welcome webinar moderator Daniel Seiden, President and CEO of Arizona Chamber of Commerce and Industry.
Welcome to our virtual leadership series webinar on COVID-19 vaccine distribution in Arizona's workforce. My name is Danny Seiden, and I am the President and CEO of the Arizona Chamber of Commerce. I have the pleasure of facilitating today's webinar. On behalf of the Chamber and the Arizona Manufacturers Council, I want to thank our guests who are joining us virtually to discuss this critical subject. Since the onset of the pandemic, our Chamber team has doubled down to help our members in the business community weather this pandemic. We provided ongoing updates of the quickly changing policy landscape to help keep our members informed. By pivoting all of our activities to virtual platforms, we were able to provide ongoing opportunities for members to meet with congressional delegation and state officials. We also launched a free bilingual statewide program to help Arizona small business owners access PPP loans. Additionally, we fought for liability reform to help job creators in Arizona regain their footing. As the highly transmissible Delta variant surges in Arizona, it is more important than ever to encourage Arizonans to get vaccinated. The vaccine is a safe and proven solution to keep our communities safe, our kids in school, and our economy open, and ultimately defeating this pandemic. Arizona has a little over than half of its population vaccinated. This is a long way from where we need to be to create the herd immunity to stave off the Delta variant. Employers can play a critical role in getting vaccination numbers to where they need to be. Employers of all sizes are doing their part to slow the spread of COVID-19 and protect their workforce and customers. Job creators have adopted mitigation strategies that have included work from home arrangements, hybrid workplaces, and flexible scheduling. And they are encouraging and sometimes requiring their employees to take advantage of the free vaccines. We know there is concern, however, about the recent mandate on employers of more than 100 employees. We would have preferred greater consultation with the nation's business community and its governors prior to the announcement, but we'll continue to keep you updated about the program and its implementation through events like these. Ending the pandemic will require a partnership and collaboration between the private sector and all levels of government. Today, we are joined by several special guests from the public and private sector who will speak to the importance of employers' efforts to increase vaccination uptake. We planned this webinar prior to the President's mandate, but we believe its content is still relevant and important as we share best practices and resources to help defeat this pandemic. Before we begin today's event, we have a housekeeping item to cover in addition to giving much deserved praise to our sponsors. For our guests who are active on Twitter, please follow us at AZChamber and use our event hashtag Leadership Series to post about our event. Today's webinar would not be possible without the generous support of our presenting sponsor, RMB3 Consultancy. Through our presenting sponsor, though our presenting sponsor is not able to join us today, Reg Ballantyne of RMB3 Consultancy asked that we share the following message. COVID-19 is anti-health and in too many cases anti-life. Vaccination initiatives have hit a wall of resistance. Vaccines, particularly Pfizer and Moderna, actually work. Breakthrough cases remain infrequent and few are life-threatening. Vaccinated people may overestimate their peril and unvaccinated people may underestimate their peril. Messaging is hard work. Success does not equal no cases. The well-being of the economy and vaccination rates are totally interlinked, and the pandemic may prove time to be endemic. The majority of businesses recently surveyed have indicated that by the fourth quarter of 2021, they could have vaccine mandate requirements in their workplace. This is a significant improvement over the current 21% and evidence that employers are taking the lead to bring an end to this terrible pandemic. It's a tragedy that the country hasn't come together from the start with a consistent approach to defeat this disease. As humanity has done with so many other scourges, smallpox, malaria, measles, polio, and the list goes on. Of course, we've never had to deal with powerfully mobilized misinformation and political expediency, which threaten advances we have made in public health. You'll hear about all of that today. Most of us do not have a direct view of the damage COVID-19 is doing. Most of the activity is in medical care institutions, physician offices, private homes, and intensive care units. But the statistics are there. The virus has cost America over 750,000 lives and hospitalized an estimated 7.2 million people. But now the silver lining is that business leaders have an opportunity to engage in kicking this nasty virus to the curb. unless, of course, we have no issue with the fifth, sixth, seventh surge. I believe that you will hear from the panels today. What you will hear from the panels today will strengthen our collective resolve to take the lead in getting our state and our country back on the right track. Knowledge and courage can certainly prevail. Thanks again to RMB3 Consultancy. We also like to thank Accenture, our webinar sponsor. And joining us today from Accenture is Eyal Darman to share sponsor remarks. Eyal works with clients across the public sector globally to help them take advantage of the digital innovations that are transforming the delivery of customer services and experiences. He is currently working with several state clients on a statewide vaccination distribution programs and contact tracing. Eyal, welcome.
Thank you, Danny. And first of all, thank you to everyone's participants in today's webinar. Again, my name is Eyal Darman, and I've spent a lot of the time over this pandemic helping with vaccine distribution and vaccine management across multiple states. What we've seen from Accenture as part of supporting our state organizations and departments of public health is a focus on the equitable distribution of vaccines, but also making sure that we're able to engage and reach to citizens and residents in the channels that they prefer. What we've seen is an enablement of reaching out to folks that maybe have some vaccine hesitancy and making sure that we're able to provide them with different ways in order to engage them, encourage them to get a vaccination, but also give them options. And I think the story of this pandemic is really a way of changing how we engage with customers and engage with residents and citizens. As part of the work that we've done, we've distributed and deployed numerous technologies. For example, in the state of California, we've deployed virtual assistants to help people with FAQs, with questions. We have a very elaborate structure in order for you to set up your appointments and make sure that we have all the various channels of engagement. So once you make your appointment, you get text notifications and alerts in order to make sure that you're able to get your vaccination, in order to make sure that you don't forget about it, and in order to give you all the various reminders that all of us frankly need in order to make sure that we get various appointments, including a vaccination appointment. The outcome of that has been a higher degree of people being vaccinated. The outcome to that has been the ability to feel more comfortable about reopening. But what we've also realized is that the first set of vaccinations is not the last. And we're now working on boosters and additional doses, and also all the variations of appointments that are needed in order to support individuals under the age of 12 that hopefully will soon have the ability for a vaccine. The work that we've done collectively with our departments of health has made an impact on increasing the availability, making sure that there is an equitable distribution with different focus areas depending on the demographic of a certain region. And again, as an outcome to that, more people have been vaccinated, and we've been able to increase the rates of vaccinations across the board. With that, I wanted to thank, and Accenture is a proud sponsor of the Arizona Chamber of Commerce and Industry, and very much thankful for being able to produce this important event with you guys. Thank you.
Thanks, Eyal, for your thoughtful remarks, and special thanks to Accenture, our webinar sponsor. We are kicking off our conversation today with Dr. Richard Carmona, the 17th Surgeon General of the United States. Dr. Carmona was recently tapped by Governor Doug Ducey and Arizona Department of Health Services Director Don Harrington to serve as a senior advisor on public health emergency preparedness and lead a statewide effort to boost vaccine and public health awareness in Arizona. Dr. Carmona, we are very honored to host you today. Welcome.
My pleasure to be with you. Thank you.
Dr. Carmona, please share with our audience more about your role as Senior Public Health Advisor for the Arizona Department of Health Services.
Sure, I'm happy to. As you know, the COVID has caused quite a challenge to all states and our country and the world. The governor and I have had a number of conversations, and as you know, Dr. Christ departed and went into the private sector, and so I was providing some guidance on some issues. And he asked me, would I get a little bit more involved and be his advisor to help Don deal with some of these issues? So the larger picture is public health emergency preparedness, which COVID falls under. And, all of the things we need to do to get people vaccinated and prevent transmissibility. And that's primarily what I'll be doing with him directly and also with the senior staff at Arizona Department of Health Services.
Well, thank you for your willingness to serve. First of all, Arizona has a debt to you. First question that I have is how does Arizona's progress fare in comparison to other states? Are we on the right track? We hear a lot of different numbers, so I'd love your opinion on that.
Sure. Well, as you know, the numbers are deceiving. Each person or group will pick those numbers that highlight their best practices. We've all struggled, let me put it that way, throughout the year. We've had points where we've had high transmissibility and others where we've done pretty well. At one point, we were leading the nation some time ago with transmissibility, and then we became one of the best. And, I've been involved directly down in Pima County because I was overseeing the University of Arizona COVID response and in fact, dealing with the state on a daily basis and the county and the cities looking at these issues. So I think overall, Arizona has done well, but I think as any leader will tell you, there are many lessons being learned as we move forward. If you think about a year and a half ago, no one knew anything about COVID transmissibility. And, all of a sudden we're in a plane at 35,000 feet learning how to fly the plane. And really, that's, I think, the appropriate metaphor. And as your previous guest said, we learn something new every day and every week. And we're incorporating the new science as quickly as we can to have the best policies, best recommendations for the public so that we can decrease transmissibility, increase vaccination rates, and really importantly, not only conserve our health and preserve and our health, but also it's about economy as well. If you want your businesses open, if you want your stadiums to be filled, if you want to recreate like we used to, the quickest path to do that is to get vaccinated.
Well said. So I guess the question is then, how do we crush COVID in Arizona, and what role does the business community play in this effort? And I'm aware that kind of is a little bit of redundant because you just said get vaccinated, but how does the business community help in that effort, in your opinion?
Well, the governor and I have a number of discussions about this, as well as Don Harrington and the senior staff. And it's one of the things that we see that in many communities, they forget about the role of the business community. The business community can do a lot to inspire the workforce to do certain things. So we're putting together a communication strategic plan. As we speak, we've been discussing it today and yesterday, and we're going to get out there with PSAs. We're going to be meeting with various businesses throughout the state to encourage them to assist us in their workforce, to inspire people to get vaccinated, and to inspire them to incorporate the best public health mitigation strategies, because that's the best way for us to return to that new normal and prevent further incurring of debt, of absenteeism in schools, closing of businesses, unemployment. People don't equate the vaccine to being a cure for that as well. So we want our economy to stay robust as well as our health.
No, and we want to be a partner in that communication and getting that message out. One thing about communication right now, especially in today's day and age, is the misinformation and the misnomers that are out there. So what are some of the biggest misnomers about the COVID-19 vaccine that you are hearing, and how do we combat that information?
Thanks so much.
Or misinformation.
It's a terrific question. And unfortunately, in the world of social media, which can be such a positive force, people use it negatively to spread misinformation and drive people with fear. First and foremost, the vaccine cannot cause disease. You hear people saying, well, I don't want to take a chance and get the disease. You cannot get the disease. It doesn't give you the virus. This is a special kind of vaccines today that at worst, you'll feel a little soreness in your arm. Maybe you'll feel, a little bit uncomfortable for a day or so, and then you're fine. So number one. Number two, there's all kinds of conspiracy theories out there. People thinking the government is going to inject you with chips to track you. And I jokingly tell them, you got an iPhone, they're tracking you already. You don't need to have to be injected. And so, but there's a whole list of them. But what's important is that it causes a distraction to get people away from what is absolutely necessary. Every citizen has to realize that it is their responsibility to do everything they can to get vaccinated for them and their family, because collectively we build a healthier community, a healthier state, a healthier nation. And then the virus has no place to go because we've extinguished it. And just like with polio a half a century ago, it goes away. It's still out there, but it doesn't affect us anymore because vaccines have been effective. And in fact, vaccines are probably the most significant advancement in the history of mankind in science. When you think of measles, mumps, rubella, tetanus, all of those vaccinatable diseases, you hardly see them. Why? Because people get vaccines. We should think of this as just another disease that's challenging us, just like the ones we've almost eradicated otherwise with vaccine. Just get this vaccine. Let's put it behind us. Let's move toward economic and health prosperity.
Well, that's very good insight. And it sounds like what we can do to help would be to have our members over communicate to their employees good information and try and dispel bad information so that we can be transparent and as trustworthy as possible. Of course, anytime some information will change from time to time, but it's important just to know as long as we're over communicating, we can maintain that trust, it sounds like.
Yes, I think that's an important point. And, your previous guest had mentioned, the issue of over communication with the right messaging and making sure the public understands. Week to week, we may be modifying direction or trajectory because something new has come out from all of the research that's being done. It's not that we're wrong. We're giving you full transparency. As we get new information, we give it to the public to incorporate in their daily activities so that they can be better prepared to fight this virus with us.
Oh, fantastic. So, Dr. Cremona, you formed the University of Arizona's COVID response team, and that was a very productive team. Dr. Robbins was a great member of the community for taking that on as well. What was the most important lessons gleaned from that experience?
Well, having been a first responder most of my life at all levels, I had great confidence in this incident command system and how it's used in complex situations like this. The challenge was bringing it into an academic environment where they're not used to using that. But I can tell you with Dr. Robbins' leadership and Provost Folks and others who got behind this, we have a well-oiled machine that's just humming every day. Every 24 hours, the president gets updates on all of the situational awareness necessary for him to make good decisions. We have different sectors responsible for different areas. So it's ongoing. And we've been doing this for a year and a half now. But it is a model that reflects our national response framework. And it's the framework we put in place almost 20 years ago to deal with what we call any and all hazards that are man-made or accidentally occurring. And COVID is one of those.
Well, I'm supposed to close out right now, but I want to just ask you, do you have anything you'd like to add? I feel we're so lucky to have you with us today. And I'm going to tell you, it's not going to be the last time the Chamber asks you to do something. You've been such a great guest for us. And we're so fortunate to talk to you, and it's been such a pleasure. Please, is there anything else you'd like to share with our guests and our membership?
Yes, absolutely. First and foremost, thank you for allowing me to be with you today. But thank you to the business community for all they're doing to help us. Down in Pima County for the last year and a half with our incident command system, the business community came right out to help us. We work with them, everything from the residence halls, hotels, and businesses, food sales. They became partners. And I think the governor wants to do the same thing at the state level. We see the power with the Arizona Chamber to be able to connect to the businesses, to get those good messages out there, and help us achieve herd immunity so we can put this behind us and have economic and health prosperity moving forward. And the Arizona Chamber and all its members are absolutely necessary for us to achieve that goal.
Well, you can count on us to be your partner, Dr. Cremona. Thank you again. This has been a real pleasure. Will definitely not be the last time we reach out to have you as a guest at a Chamber event, whether hybrid or virtual, whatever this is called. We'll have you live hopefully soon. And again, just we're the state's lucky to have you building upon Dr. Chris and her success. So thank you very much, Dr. Cremona.
Thank you very much.
We are also joined today by Michael Carney, Senior Vice President of Emerging Issues at the U.S. Chamber Foundation, to talk about national trends among private employers regarding COVID vaccination distribution. Michael leads the U.S. Chamber's pandemic response. Michael, welcome.
Thanks for having me, Danny.
No, thank you so much for coming. Michael, this is a different conversation now with President Biden's recent vaccination mandate for businesses. Can you tell us how the U.S. Chamber is assessing the administration's announcement and what message the Chamber is sharing with businesses across the country?
Sure, Danny, and thanks for having me. This is an important conversation. And, as I was saying to you before, almost every day there's a new element to this global response to the pandemic. What we're, this is there are strong views about the policy proposals that the president announced last week. We expect it to be the subject of litigation, and I believe it already is. But our responsibility is to ensure that we communicate to the government the need to make this to limit the burden on employers, and at the same time, we have a responsibility to help the more than 110,000 employers who are potentially covered by this proposal, to help them plan, to make sure that they are ready to implement it if it takes effect. And to ensure that the continued efforts of employers are not disrupted. The efforts that employers have been making for quite a while now to promote and facilitate vaccination of their workers. At the end of the day, we all have a shared goal, which is to see as many people vaccinated as possible, because that is really the only way that we are going to make meaningful progress against COVID-19.
Yeah. Excellent point. To your point about litigation, in fact, Arizona was the first in the country to file a lawsuit against this yesterday, against the Department of Homeland Security, I believe. So it'll be an interesting lawsuit to see how that plays out. I imagine we won't be the last to file litigation, as you pointed out, as this continues to evolve. Now, an important starting place for employers is to assess their vaccination rates. And this is an extremely sensitive area in really uncharted territory for a lot of employers, because we're talking about employees' medical records. So how have employers across the country collected this information from their employees to determine their baseline COVID vaccination rate, even prior to implementing a new policy?
Yeah, no, it's a great question. So for many employers, they're flying blind. They don't really know who is and who is not vaccinated. And in many cases, that is intentional. They didn't see a need to verify vaccination status. And frankly, most employers don't have a track record of checking vaccination status. Up until recently, the vaccination regime in this country was managed through the schooling system. So you had to show proof of vaccination to go to school. And then there were just assumptions made later on that you had all of the required vaccinations against infectious disease. COVID has opened a new chapter for us, and employers are working overtime trying to figure out the best way for them to be responsible actors in this kind of unprecedented time. So what we've seen so you saw a lot of companies begin to offer incentives in the spring for workers to get vaccinated. And that became a way to identify who was vaccinated. It doesn't tell you that someone isn't vaccinated, but it gives you some confidence that the individuals who were seeking or accepting the incentives were. What we did at the chamber was we did a survey of workers, anonymous survey of workers, to see just overall what percentage of our folks were vaccinated. And we were really happy to see that almost all of them were vaccinated. For those who either had not been vaccinated or hadn't completed the regimen, they were asked to just talk to the HR department about their plans. And I'm not part of those conversations, so I don't know where that ends up. But I have talked to other employers, and what they've found is that in many cases, people who are not vaccinated, they're not making this decision out of ignorance. They're also not making it out of any deep opposition to the vaccine. It's important to remember that the majority of adults in America have received at least one dose of the safe and effective COVID-19 vaccines that are available in this country. So people who are unvaccinated, there are many reasons. There are those who have claimed medical or religious exemptions. There are many who are concerned about potential side effects. There are others who have not been vaccinated because they're either they've been subject to misinformation. There's been a lot of misinformation about the vaccines floating around out there, and this is unfortunately a reason that we've also seen in years past people not get the flu shot. They just haven't made the time because they either don't know that or don't think that COVID is a serious threat, or it hasn't been easy or accessible. In a lot of those categories, what employers are finding is that having conversations from a place of empathy is a very effective way to steer people to make the right decision for them. In the end, this is a personal choice.
You Absolutely. And you touched on this a little bit. Employers do have a big role to play with vaccine distribution. And you mentioned that in the beginning, a lot of it was incentive based, and we've seen a lot of debate about the carrot versus the stick. But what positive trends are you seeing among employers to encourage vaccination? Can you share any best practices that we can pass along to our members?
Yeah, we've seen all kinds of creative solutions. So you've seen companies offering money. We've seen companies offering paid time off. I talked to one company in the Midwest that was having a raffle for an ATV because that was what would motivate their workers. So companies have taken really creative steps to incentivize employees to make the personal choice to get vaccinated. We did some research early on in the pandemic. And what we saw was that the most persuasive thing that an employer could do was to lead by example. So at least at that stage in the pandemic, back when we did not have the bountiful supply of COVID vaccines that we do right now, employers who were getting vaccinated early on, showing their workers that they were getting the shot in a photo with a personal story, explaining why they were getting vaccinated, and then dispelling some of the concerns that people have about the immune response to the vaccination, that it might make you sick or that it's, worse than COVID. None of that's true. And in the vast majority of cases, people have very minor reactions to the shot, all of which is to be expected. It shows that your immune system is working according to the doctors. I mean, employers have been pulling out all the stops since December. We have now a mix of carrots and sticks. But what we've learned over time is that most workers, most Americans want to do their part to help stop the pandemic, make sure that we can, protect the community's health and that we can protect our continued prosperity.
Well, that's great. One question I would have about that, again, you're making my transitions easy for me, is what best practices have you seen among employers regarding a communication standpoint? Because they
Transparency.
Yeah, I was going to say, one, communicate to their employees, and then an outward communication to the community about what they're doing. We have said here in Arizona multiple times, we're a coalition of the responsible. We have our members taking care of our employees, but also doing their part for the community. So, what are the best practices for communication, both internal and external, that you've seen?
So in a word, transparency. I would say that, being open and honest with people. One of the challenges that we've had since the beginning of the pandemic is that this is the definition of ambiguity. What we know today might differ and is likely to differ from what we know in a few weeks. And that doesn't mean that we're wrong today. It doesn't mean that someone had ulterior motives. It means that we are learning. As we learn more, we're making policy decisions for the workplace. So employers that talk about what they're doing and why they're doing it have, I think, a much more meaningful impact on their employees. It helps keep them safe. It helps prevent infections in the community. And it helps people understand that we're really all in this together. No one has a monopoly on facts here, but the science is ultimately what's going to get us through this. And the more we can educate people about what the science shows today, and what the scientists and doctors think is the most effective way to both stop the spread, but also to prevent future infection, the better. So over communicating, I can tell you what doesn't work. I've seen companies and I've seen others put out one message about vaccination and then say, well, I did that. What this requires is an ongoing cadence of communications.
Understood. No, that makes a lot of sense. I was going to ask is, have you found the one gold standard member that to have done the best job with this that you use, when you travel around and speak as the shining example that we can share?
No,
No,
there's no gold
in fact.
standard because, one of the interesting things about this is that, and we've learned over the course of the pandemic, every community is different, every individual is different, and every workplace is different. And so the most effective, the gold standard, is any employer, whether it's the largest of companies or the smallest of companies, that adapts to meet the unique circumstances of its people and meets them where they are. In some places, people aren't getting vaccinated because of language problems. In other places, people aren't getting vaccinated because they have accessibility issues. They may not be able to get time off from work, or they may not be able to get to the vaccination clinic. So those employers are giving them paid time off. And there are, there have been tax incentives for smaller employers to do that. They're bringing the clinics to the work. So instead of there being one universal gold standard, I'd say there are probably millions of them. Millions of companies, millions of organizations have pulled out all of the stops since December of 2020, which is when employers first started vaccinating their workers at nursing homes and hospitals. And if you look across Arizona, you look across the country, you'll find that gold standard in your community.
Yeah. Thank you so much. I mean, that was really helpful to us, Michael. We really appreciate you taking the time to talk to us today, and everything that the U.S. Chamber is doing for our nation's job creators, both here in Arizona and everywhere else. These were good messages to carry on. Over communicate, be transparent. Keep pushing the incentives, and meet your employees where they are. So thank you so much, Michael. This was very helpful.
Thanks for having me, and thanks for doing this.
Absolutely. Next, we have Christina Corriere, Senior Advisor to Governor Doug Ducey, joining us to discuss the various resources offered by the state of Arizona to employees. Christina, welcome.
Thanks, Danny.
Yeah. The state of Arizona is the largest employer in Arizona. Tell us more how the COVID-19 vaccination fits in with the state's overall vaccine program for employees.
Well, the state has long incentivize the getting of vaccinations. So for instance, with the flu vaccine, it's usually offered on site. Arizona also has a healthy impact program that rewards employees for hitting various milestones. And if they reach a certain number of points by the end of the year, they are able to get $200 back. They've consistently given points for getting the flu vaccine. We'll continue to do that, but we're also able to add points for getting the COVID vaccination. We also were able to offer on-site vaccinations for employees. Employees couldn't get them any sooner than the general public based on their eligibility categories. But many of the state employees were eligible in the early categories. So if you remember, Arizona in the beginning authorized healthcare workers, law enforcement, teachers, and individuals over the age of 75 to get vaccinated. The state obviously has law enforcement. If you look at folks like the Department of Public Safety or the National Guard, as well as our correctional employees at the various corrections locations. We also have healthcare workers at the state hospital. So we were able to offer on-site vaccination as soon as someone is eligible at the Department of Administration and on-site at all of our prisons. So of the 36,000 or so state employees, we actually vaccinated over 11,000 on-site. And those on-site vaccinations continued till the end of March when the general public became eligible to be vaccinated, and then state employees were directed to the state vaccination sites like the rest of the population.
So, you kind of answered this question, but I'll try and ask it with a little bit more to it. Is it your opinion then that state employees are taking advantage of the vaccine program that you offer? And do you have like a good number of what the success rate is?
So we know that 11,000 were vaccinated on site, which is about a third of our employees. In regards to how many have gotten vaccinated since then, we don't have data for that yet, but we should at the end of the year as we go through and calculate who's reach the required points in order to get the healthy incentive rewards.
Also, as the government, you're also a point of contact for just information in general. And one thing that we've heard repeatedly today is the need to dispel misinformation and misnomers that come out about the vaccine. What are some of the misnomers about the COVID-19 vaccine that you're hearing?
It runs the gamut and it changes by day. And you have ones that are truly crazy that you wonder how that idea got started, things like there's a tracking device in it. But then you get ones that are legitimate questions where people are really confused and it just takes time to talk to them. So, one piece of misinformation that was spreading for a while was that vaccinated people shed the virus and thereby spread it. Well, that's not accurate because none of the 3 approved vaccines contain any live virus, and you only shed virus when you're infected. So simply the act of getting a vaccination is not going to make you shed any virus. But when people use language like that on the internet, not a lot of people know what it means, so you have to walk them through it. I would say the one that we're hearing most right now is folks that are saying that the vaccine doesn't work because there are breakthrough infections. And it's true that there's breakthrough infections, although I would challenge anybody to find me a single pharmaceutical that is 100% effective 100% of the time. I think just sharing data about how it works and the effective level is important. So for instance, the CDC just released another study. This one was done of tens of thousands of cases in July and August, so at the height of Delta. And what it found was that vaccinated people were 4 times less likely to become infected, which is important, but even more important, they were 10 times less likely to go to the hospital for their infection and 11 times less likely to die. So the vaccine does reduce your risk of getting COVID, but it significantly reduces your risk of getting a severe case such that you would need hospitalization, and it dramatically reduces the chance that you would die from the virus.
Is there a central point that the state offers where people can go get, information to beat back on this misinformation, or is there something you direct people to that you would want to share with the chamber right now?
I don't have one site that has every single piece of misinformation, mostly because there's new ones every day. The CDC does put out some good facts and fiction and fact checking these claims. I know the Department of Health Services also puts up blogs from the director periodically that share actual data, including the percentage of folks that are hospitalized in Arizona who are vaccinated versus unvaccinated. Their most recent blogs have shown the same thing, that data shows that 94% of our hospitalized cases in Arizona are from people who are not fully vaccinated.
Christina, a lot of us get our information about the number of vaccinated from the ADOT signs when we're driving on the freeway. But what I wanted to ask you is, are we seeing an uptick in vaccinations in Arizona from what you've seen with the numbers you look at on a day-to-day basis? And do you think that's due to the Delta variant?
The number per day really peaked in late March and early April. Early on in the vaccine, you had a group of people that were very, very eager to get it, and demand was very high. We saw demand drop to as low as about 9,000 vaccinations a day in late June or early July. We've since seen that pick up. We're anywhere now from about 14,000 to 18,000 vaccinations a day, but that's because we've hit the group that was harder. Not necessarily the group that's anti-vax and opposed to it 100% of the time, but the people that have legitimate questions, and it just takes a little more time of talking to them and working with them and helping them get comfortable with the vaccine.
So, Christina, thank you so much for taking the time to meet with us today. Is there anything else you want to share? You've got so much experience in healthcare, and you've been side by side with Dr. Chris, and I imagine you'll be side by side with Dr. Carmona and the new team. Anything you want to share with the chamber, with the people watching?
I would just say that I'm vaccinated. I got vaccinated at my first opportunity. I've read all the studies, and if I had any concerns, I wouldn't have done it. But I don't have those concerns. They've all been satisfied, and I'm willing to talk to anybody about the importance of vaccines and how they are the way out of this pandemic.
Well,
I would also say they're why we don't see polio and smallpox and all of those other diseases that previously devastated families and individuals' lives. The reasons we don't see those today are because of vaccines, and vaccines will be why we don't see COVID in the future.
Well said. And I want to point out that we are very lucky to have Christina Corriere in government service. She's a true civil servant. I was lucky enough to work with her once upon a time. She is a genius, and the state is lucky to have her. And again, we were lucky to have you today. So thank you so much, Christina, for your time.
Thank you.
Next up is Dave Dexter, CEO of SonoraQuest Laboratories. SonoraQuest Laboratories is an independently run joint venture between Banner Health and Quest Diagnostics, the nation's largest integrated laboratory system with approximately 3,200 employees serving more than 28,000 patients every day throughout Arizona. Dave, welcome.
Thank you. Pleasure to be here.
Pleasure's all ours. In July, SonoraQuest Laboratories announced that employees who have direct patient interactions or who regularly work at Banner Health facilities are required to be fully vaccinated by November 1st, 2021. Can you please share more about how you reached that decision?
Yeah, I'd had some discussions with Peter Fine, CEO of Banner Health, in regards to where he was headed with Banner Health as a system. I've had other discussions with CEOs of other hospital systems as well, who are clients of SonoraQuest. And everyone concurred that this is healthcare. And we're getting hit pretty significantly with the Delta variant of COVID right now. And so if healthcare is not going to be vaccinated, who is? And so when you look at what's transpired over just since in this third quarter, the healthcare system has spent over $5.7 billion on unvaccinated people who have been hospitalized. So that's pretty significant. I think for me, it's more complex because we have 1,500 employees on the Laboratory Sciences of Arizona side, which work all in the Banner Health hospital laboratories, not just in Arizona, but outside of Arizona as well. And then SonoraQuest, of course, is a joint venture between Banner Health and Quest Diagnostics. So I have a fiduciary responsibility to two very large but disparate parent partners. And so I have more flexibility on the SonoraQuest side than I do on the LSA side. But because it's an integrated laboratory network, we want to keep the policies the same throughout the environment. So I think because it's healthcare, we're accountable to our patients. We want to keep the safest possible environment for our patients. And certainly we're accountable to each other as healthcare workers, and we want the safest possible workplace as well. And so that led me to supporting Peter's decision to mandate vaccines. I will say I'm not a proponent of mandates. Whether it's mandating a mask or mandating you don't wear a mask, I'm not a big proponent of that. So what I would share with you is I've tried to, with our senior team, to make it an education and also a strong encouragement to get vaccinated. And by that, I mean, we provide every employee with a $25 travel stipend to get to a place where they can be vaccinated. We also provide them 2 hours of paid time off in order to get vaccinated. We have created 80 $1,000 draws for people to get a $1,000 incentive if they've been vaccinated. And just yesterday, sweetened it even more, offered to pay anyone who becomes vaccinated $300. And so I don't know of any other company that has put it in terms of trying to encourage employees have done more. But I think if those incentives don't work, then a person's just not going to get vaccinated.
Yeah. And do you, can you tell me a little bit about the reaction from your employees prior to the announcement? Or I'm sorry, post the announcement? Yeah.
Yeah, so I think, a lot of things have changed just since July, Danny. back in July, early July, it looked like the pandemic was going to end. Even President Biden said so.
Yeah.
We weren't really sure if we were going to see a surge with the Delta variant. And in fact, we not just saw a surge, it was a very, very significant surge. In fact, I can tell you in the month of August alone, Sonora Quest performed over 385,000 PCR tests in Arizona. And so we didn't know, for instance, that people who were fully vaccinated, that 17% of them would have breakthrough infections, and that 6% of them would end up in the hospital. And we didn't know that a fully vaccinated person could become infected with COVID and actually transmit it to other vaccinated people or unvaccinated people. In fact, every infected person can transmit it to 7 to 9 other people. We didn't know that the Delta variant would, in fact, result in significant infections in kids. So 20 to 25% of the new infections are in children. So these are things that are facts that we just really didn't know in early to mid-July. And I think what it does is it really accentuates the need for getting vaccinated. And that's why I favor the education and also the incentive part of it, more so than just the stick.
Yeah, no, it sounds like you've had a approach, even though you've announced a mandate, you've been offering incentives the entire time. So kind of a stick with a very carrot on it the entire time. So that does lead me to want to know, have you been able to track your vaccination rates both before your announcement of a requirement and to now, to today?
You know, we haven't moved the needle that much. We have less than 60% of our employees vaccinated at this point, as of yesterday when I announced a $300 incentive. You know, there's complications with this, because when you look at a mandate, I'll use our billing department, for example. Our entire billing department of 175 people is working at home. And so, you know, as a CEO, it's conflicting for me to mandate a vaccine for people who are working at home. Now, we are putting in a testing program, which will be a PCR pooled testing protocol to test employees who do receive exemptions. Right now, exemptions are going to be for medical reasons and also for religious reasons. But we might we've been contemplating personal exemptions as well. So a personal exemption might be somebody who is working at home. They're not coming into the office. They're not interacting with patients. And so we're looking at how we would support that with testing. Now, the problem with President Biden's executive order is that it's really a mandate with a big stick. And the stick is that if all your employees don't become vaccinated by some unspecified date, we don't know what that is, then you will not be reimbursed by Medicaid or Medicare. That essentially puts any healthcare provider out of business that is serving the entire continuum of healthcare as we do. So there's a lot of unknowns with that. So that's quite a bit different than the employer mandate for companies that have more than 100 employees. And even in that situation, while you don't have the big stick with respect to Medicare and Medicaid reimbursement, you know, they're basically saying companies can afford to do the testing on their own. You know, currently diagnostic testing is reimbursed, but surveillance testing is not, except in the case of specialized circumstances for K-12, like we have with pooled PCR testing. So that means that the employer has to bear the cost. And and by the way, the government is willing to reimburse people for an at-home rapid antigen test, which is, just a quick way to get an inaccurate answer in my world. So, it is what it is. If you want to get a rapid result, just to get a rapid result, then, that's your decision. But the reality is a PCR test is the gold standard, and it's 100,000 times more sensitive than an antigen test. And an antigen test could be has applications when the virus prevalence is really high. In Arizona, we had at one point in 2020 a virus prevalence that was number one in the world at 30%. That then is an application for an antigen test. But when you're down to where we currently are at 12 to 14%, it has limited value. And when it's at 5%, and supposedly the virus is, quote, under control at that point, then, it has, very little value.
So there was a lot in that answer, and I want to unpack a couple of things a little bit later. But I had a question that since you got into the nuances of testing, you've seen the impact firsthand. You've processed, I think, 3 million tests nearly. Can you talk a little bit about the improvements to testings, innovative partnerships that you've started to help the back to school efforts? Because we just saw our test scores. We saw how devastating it was to lose the time in the classroom, and what you're doing, the partnerships that you're striking, is making such a big difference. Could you talk a little bit about that?
Yeah, so the partnerships really go back into 2020, where we formed a laboratory consortium it included ASU and U of A and Mayo and TGen and a number of other entities throughout the state to really get a firm handle on what types of testing were available in the state, what type of capacities, et cetera. And then beyond that, Sonora Quest formed a partnership with the Arizona Department of Health Services to create what I called Operation Catapult, which was to catapult SQL ahead of PCR demand in Arizona. We completed that last August, the first week of August in 2020, and built our PCR capacity to 60,000 tests per day, which frankly was one of the tops in the nation. In fact, we took Arizona from being last in the country in terms of PCR testing per capita to number one. And then beyond that, as we got into the major second surge in November, December, or January, that provided a PCR testing safety net for Arizona and carried us through that. And then as we came out of that, one of the things that I got to thinking about is how can we really make a difference for Arizona? And what came to mind was developing a PCR pooled testing protocol for K-12. And so I set our teams out to be able to do that. Pretty extensive validations in order to do that, but I can tell you that we validated pools of 5 specimens, 10, 15, 20, 25. And early on in that process, partnered with Mara Aspinall, who's the CEO of Health Catalyst and also an ASU professor. And we worked together with the Rockefeller Foundation to assess testing around the world, and also to develop and support financially pooled PCR testing. So Mara formed what's called NTAP, or the National Testing Action Plan. And Mara also coordinated with the Biden administration, as well as CDC and HEW, to get funding for K-12. And that funding was provided to the Arizona Department of Health Services. We partnered with another company called Ginkgo Bioworks. They're a $4.5 billion company in Massachusetts. The CEO, Jason Kelly, is, an MIT PhD, so he's a lot smarter than me, but I'm more experienced than he is. So it makes a good team. And we did put together a very successful pilot on PCR pool testing for K-12. It worked perfectly with 4 or 5 districts. And today we have over 400 schools in the state signed up. Not doing as much testing as we expected to do. We're doing about 1,000 specimens that are pooled every week. The limitation that we have is that we haven't been allowed to share with parents the merits of a PCR pooled testing system. So if you go on the SQ website, there's very thorough information on that. If you go on the Ginkgo Bioworks site, also very thorough information. Ginkgo's developed a very strong front end software to support the education of school districts, nurses, school boards. They have developed all the collection protocols, the parent opt-in. So it's a very thorough, comprehensive program, and SonoraQuest supports it in terms of picking up pooled specimens at every school in the state and doing the pooled PCR testing and turning that around in 12 hours. We have an interface, computer interface that is built directly to Ginkgo Bioworks. So the results are available on their website to the schools. We have a backup program for individual PCR testing for if a pool of 10 tests positive, then we have a protocol that works very effectively partnering with embryo collection sites. And so we can get individual students tested as well. So it's very comprehensive. Frankly, I think it's a benchmark model for K-12 testing nationwide. And by the way, I just want to add too that the Arizona Medical Association has also looked at this in depth, and I asked them to publicly support it because we're not in this to make money. We're in this to do the right thing to support the safe return of K-12. And when you look at what's happening with the Delta variant and a number of kids that are being infected, this is absolutely the right thing to do. And by the way, the Arizona Medical Association, in almost an unprecedented move, is supporting this 100% with all of their physicians as well.
I just want to say thank you so much for joining us. I think we're very fortunate to have SonoraQuest Laboratories here in Arizona. Thank you for helping get our kids back to school. I have 3 of them myself, so I'm grateful. I make a terrible homeschool parent, so that's one thing I learned about myself. So I really appreciate what you're doing there. And I know that's not about the money, and it's about you being a good corporate citizen. And I'm proud to represent you at the Chamber, and the Chamber's happy to have you amongst our members. So
yeah, my pleasure, Danny.
Yeah, thank you so much. And you've been indispensable for Arizona. Thank you again.
Okay, thank you.
We also have the pleasure of hearing from Tucson Medical Center today. Julia Strange, Vice President of Community Benefit, joins us to share more about Tucson Medical Center's approach to vaccine distribution. Tucson Medical Center is a nonprofit, locally governed community hospital committed to addressing unmet community needs, investing in underserved areas, and providing outreach and collaborative programs to benefit the health and well-being of Southern Arizonans. Julia, welcome.
Thanks for having me.
Julia,
glad to be here.
Yeah, no, we're lucky to have you. Julia, Tucson Medical Center has been in the trenches dealing with the pandemic in Southern Arizona. And your announcement to require hospital workers to be vaccinated last month made the news. Can you tell us about your decision and how your employees reacted to that announcement, both pro and con?
Sure, absolutely. At TMC, we really began engaging in the vaccination program last December, and we are one of 2 sites with Banner that began to vaccinate healthcare workers when the vaccine initially came out. And naturally, through that process, about 75% of our employees were vaccinated. In July, as we saw the numbers of COVID is we started to see the fourth surge develop, and we became very concerned about the Delta variant. It became clear that the right decision from a safety standpoint for our patients, for our staff, for our visitors, and for our community was for TMC to set a goal of 100% vaccination. And so we made that announcement in mid-July, and we began working through that towards the deadline of September 1st. And we had everything from employees thanking us for taking this step so that we could be safer and be more confident in our work and our ability to care for our patients and be together in a safe environment, to patients or to employees that had very significant concerns about taking the vaccine, both from a religious standpoint, a medical standpoint, and a variety of other standpoints. And so we began those conversations with our staff and working through that. And as we work towards the end of our process, we believe that we'll have about between 97 and 99% vaccinated, with the remainder of our staff who will have exemptions for medical or religious reasons. There will be some staff who will have elected to not be vaccinated and therefore will have left the organization.
Well, 97 to 99% without being forced by the government sounds like a fantastic percentage rate.
Mm-hmm.
Tucson Medical Center has gone above and beyond to accommodate its workforce during the pandemic. Can you share some of the innovative programs that you implemented to help your employees navigate the pandemic internally?
Absolutely. We've found that the needs of our staff have really evolved as the pandemic has carried on. Initially, we have throughout done all of the things that you would expect to do as a business, which is, as we ask for extra shifts, we do bonuses and overtime pay and that sort of thing. We've learned that we really have to go deeper than that. It really is a holistic approach to how we can engage our workforce so that they continue to have the resiliency to continue to come to work every day. So, for example, we implemented a Healing the Healer program, which is really designed to help build the resiliency of our workforce. So everything from mental health interventions and opportunities to talk to counselors, to different kinds of events, such as, we know with resiliency, you get resiliency from taking care of other things. So we've had plant giveaways, and we've had, ice cream socials and that sort of thing. We are actually opening up this month a Healing the Healer patio, which is a donor-funded patio within our hospital where only employees can go. It's right in the midst of where our patient care areas are. Sort of a place for meditation and healing and quiet, to be able to step away from the front line and get that peace. We have done everything from providing laundry services for our staff to having oil changes on campus. And last, in the beginning of this year, the second semester of the last school year, we actually had a school on campus. So staff who had kids from first to, I think it was sixth grade, were able to bring their children in the morning on their way to work, drop them off. They have a supervised area with Higher Ground was the group that we used. And they helped them through their day with their online learning. And it was a really innovative program that we put forth because our staff were concerned about leaving their kids at home to do that learning on themselves. So really looking beyond what we might have before the pandemic to a more holistic approach to help people build their resiliency, have the support they need in their personal life so they're able to come to work and care for the patients that we have here.
That's a good transition to what my next question was going to be. And, we were seeing a shortage in the healthcare employees, workforce prior to a pandemic. Then the pandemic comes along and we have this unprecedented burnout, and we're hearing more and more about nursing shortages and healthcare worker shortages. Could you tell us what you're seeing from that perspective and, how it evolved during the pandemic?
We are, like every other healthcare organization in the country, facing a shortage of healthcare workers across the board. At the beginning of the pandemic, we found that when we put out requests for employees to pick up additional shifts and to give more, they were able to do that. They had the resilience, they had the resources within themselves to go that extra step. And the pandemic was new, and there was an energy to step beyond what you might normally do. As it has extended, we have found that our staff rightly have said, I can give this much, and I can't give those extra 1-2 shifts a week that I was able to do early on, because they need to take care of themselves, and we support that. We think it's very important for people to take time for self-care, to build that resiliency, so they are employees for the long run, and they're able to deal with the burnout, so they're able to come out the other side stronger and able to continue to serve our community. So that's really, we've seen this transition into this different space where employees are saying, this is what I have. And so we're doing a variety of things to focus on building new nurses, bringing people in who can grow into those roles, adding patient care technicians who can support the nurses, so that we can get the staff available to take care of the patients that we have.
Thank you for that answer. And it sounds like you're doing some great innovative things that some of our other members can maybe learn from as well. Could you tell us what you're seeing from a hospital capacity standpoint? And I ask with this angle, what extent have you seen vaccines being able to keep patients from being hospitalized? Has that changed from when the pandemic first started?
It's very clear that the patients that are hospitalized today with COVID are predominantly unvaccinated, particularly in our ICUs. We are experiencing incredibly high volumes in our hospital. But it's not the COVID that is driving. It's not necessarily the COVID patients like we saw last winter. So, for example, last winter we would see in part of our census 170, 180 of our patients, of our 400 to 500 patients, would be COVID. Now it's about 30. That drop is because of the vaccine. But we are seeing an incredible amount of other patients. So the heart attacks, the GI, the bowel obstructions, a variety of other issues. So we're very busy, but COVID is not the primary, the driver of our capacity issues. And that is due to the vaccine. I believe that if we had not done the work throughout this year to get our communities to the level of vaccination they are, that this surge would be even worse than it has been.
Well, thank you for saying that. We're going to continue to push out that message from our role. Could you give us your view on the role of business and business leaders in defeating the pandemic? What is required of today's business leaders in the context of public health crisis like the one we're going through?
Right. I believe that businesses have a variety of roles to play. First of all, encouraging employees to get vaccinated is good business. It impacts your productivity, it impacts the number of sick calls you have, and it impacts the safe, effective environment of the workforce, of the work environment that you're creating. And I believe that businesses play a critical role in that. We have, as a society in this country, we have said, we have sort of given businesses the lead role in terms of providing healthcare insurance for so many in our population. So we have as business leaders, we have a direct role in the healthcare system, and that is as the insurer. And so from that standpoint, encouraging and or up to mandating vaccines is something that businesses should look at very seriously. It impacts absenteeism, it impacts your healthcare cost, and so much more. So I think from that perspective, businesses can play a key role in addressing this public health crisis. And I would encourage all business leaders to take this responsibility and this mantle and carry it forward, so we're in a place that we can move on and do some of the great things we know are ahead.
Thank you so much for that for saying that. That's something we're going to carry over and share with our other business leaders that are panelists. And I can tell you that that is a sentiment shared by many of the members here at the Chamber who feel like they've been working hard to be what we've called the coalition of the responsible, protecting not only the employees, but the community as well. But no one has done that more than the healthcare community. So thank you so much for sharing with us today. Thank you for what you're doing in Southern Arizona. And thank you, Julia, just for joining us today.
Absolutely. Thanks for having me. I really appreciate it.
Yeah, thank you so much.
Okay.
And thanks to all of our distinguished speakers. We truly appreciate you taking the time to share your insights with our members, especially given today's virtual format. Special thanks again to RMB3 Consulting, our presenting sponsor, and Accenture, our webinar sponsor. Reg Ballantyne, we did miss you today, and we know your passion around this subject. We look forward to seeing some of you at our upcoming events starting next month with our Eggs and Issues Breakfast on illegal trade in Arizona and continuing with the Arizona Manufacturers Council Summit Made in Arizona Tour. There is a lot happening at the Arizona Chamber. Please visit our website for a full listing of our upcoming events at www.azchamber.com. Thanks to our members and guests for tuning in today. Be well.